Thank you for listening to Depictions Media Radio. Welcome back to Depictions Media Radio. I am your host, Michael Clogs. In this next segment, we're going to hear from the Pan American Health Organization Director, Dr. Carissa Etienne. And Dr. Etienne is urging countries in the Americas to prioritize rapid testing. With 7.2 million new cases of COVID reported in the region over the past week, countries must expand their testing at the community level to relieve pressure on hospitals, which are working on overtime. Here in Canada, that we've heard different reports from Adrian Dix and from Dr. Tam about how overworked healthcare workers are, and how it could be from exhaustion. In a previous report that we heard from Adrian Dix talking about the number of healthcare workers that had called out in just the past week, and how many hours were actually lost because of the lack of staff, and how it can possibly be affecting the level of care that's actually given. And some of it could be because of overworked healthcare workers. But Dr. Etienne goes on rapid antigen tests, which over a diagnostic in just minutes, to do not require equipment or training, can be employed by primary health centers where they can reach more people closer to home. And that can be pretty important, again, relieving some of the stress off of the hospitals and hospital workers. So why don't we listen to what Dr. Etienne and her team at the Pan American Health Organization, or PAHO, actually have to say as they address the media.
Hola, buenos días, buenas tardes.
Hello, good morning, good afternoon, everyone. Welcome to the press briefing of the Pan American Health Organization, PAHO. My name is Luciana Viega. I am advisor for communication affairs. Today is Wednesday, January 19, 2022. We have interpretation into English, Spanish, French, and Spanish. And we have received many of your questions beforehand, but you can also put your questions on the Q&A and the chat. And please remember to include your name and outlet. Today, Dr. Carissa Etienne, Director of PAHO, will give you an update of the status of COVID in the region, and she will talk about COVID testing as well. She is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies in PAHO, and Dr. Sylvan Aldigueri, Incident Manager for COVID-19 in PAHO. Now, over to Dr. Etienne, who will give her initial remarks. Dr. Etienne.
Good morning, and thank you for joining this week's press briefing. COVID cases continue to accelerate, reaching new peaks in our region. Over the last week, the Americas reported nearly 7.2 million new COVID infections and more than 15,000 COVID-related deaths. In North America, the United States and Canada continue to experience a surge of COVID hospitalizations. Panama, Costa Rica, and Honduras are reporting the highest number of new COVID cases in Central America, with cases more than doubling over the last week. The Caribbean islands are witnessing the steepest increase in COVID infections since the start of the pandemic. Cases in Martinique have increased by more than 600%, and in St. Martin, they have risen by more than 135%. Cases have at least doubled in more than 17 countries and territories, which is especially concerning as hospital capacity in many islands remains limited. COVID infections are accelerating in Colombia, Peru, Brazil, and Bolivia. COVID hospitalizations are also growing in Paraguay, Uruguay, and Argentina. Although Omicron infections appear to be milder, we continue to urge caution because the virus is spreading more actively than ever before. That means it is critical to protect our health systems so individuals who need care can count on it. And the best way for us to protect our health systems is to get vaccinated when it's our turn. Vaccines shield us from the worst COVID symptoms and reduce our chances of needing hospitalized care. More than 60% of people in Latin America and the Caribbean have been fully vaccinated against COVID. We aim to vaccinate at least 70% of the population by mid-2022. PAHO's revolving fund will soon reach the milestone of delivering 100 million doses of vaccines to 33 countries. And as more vaccines become available, we encourage those who haven't been vaccinated, please, to do so. As COVID surges throughout the region, countries are facing a familiar challenge: COVID testing. The good news is that even before COVID arrived in our region 2 years ago, PAHO has been working to bolster our region's laboratory capacity to respond to emerging pathogens. So every country had the training, the supplies, and the ability to perform COVID diagnostic tests. Today, we have a network of more than 32 laboratories across the Americas, including national influenza centers and public health laboratories in at least 29 countries. These labs analyze virus samples from our region to help countries track and learn how this virus is evolving. The network is also on the lookout for new or evolving viruses so that our region is prepared as new threats arise. This network has helped detect the arrival of Omicron in countries like Guatemala, Honduras, and the Dominican Republic, helping governments adapt their responses to this latest wave. But even with this strong lab network, demand for testing is higher than ever, especially as many countries in our region are also experiencing an active flu season. So it is critical that countries use tests smartly. We believe that the best way to scale up testing is to leverage rapid antigen tests, which offer a diagnosis in minutes and not days. Rapid tests do not require specialized training or expensive equipment, and they can be deployed to primary health centers where they can reach more people closer to home. We urge countries to expand testing at the community level to relieve the pressures on hospitals which are working overtime. Because we are facing a testing shortage, PAHO recommends that countries prioritize rapid antigen tests for individuals who are experiencing COVID symptoms and are at risk of spreading the virus. Individuals who are asymptomatic and have been or think they have been exposed to COVID should be advised to quarantine when possible and to follow effective public health measures like social distancing, mask wearing, and avoiding large gatherings to prevent getting others sick. Be assured that PAHO is doing everything that it can to support countries. Since the COVID-19 emergency began, we have acquired more than 42 million PCR and rapid antigen tests for 36 countries through the PAHO Strategic Fund. We have deployed 10 million PCR diagnostic tests and 2.8 million rapid diagnostic tests from our stockpile in Panama to countries in need. In the last few weeks, we have sent tests to quickly increase capacity in Bolivia, Suriname, Trinidad, Tobago, and St. Kitts and Nevis. PAHO has also established long-term agreements with 2 of the WHO-approved manufacturers of COVID diagnostic tests so that we can secure tests for our region at a fraction of the price. Countries can and should take advantage of these agreements by purchasing diagnostic tests through our strategic fund. Since January of 2021, our strategic fund has purchased more than 22 million COVID tests, including PCR and rapid diagnostic tests, on behalf of our countries. And we expect our orders will ramp up this year. As Omicron continues to spread rapidly throughout the region, our testing capacity will be limited for some time. And that's why it's important to remember that testing alone will not overcome this virus. Slowing the spread of COVID will require every tool in our arsenal: vaccines, social distancing, mask wearing, avoiding large gatherings, and testing. We need to rely on all of these measures to continue to protect ourselves and each other against this virus.
Thank you, Dr. Etienne. We stay with the topic of health measures for our first question now from Felipe Llambes from BBC World, BBC Mundo, the question in original Spanish, but I will translate it very freely here in English. Why do you recommend continuing with measures for the entire populations in country in the region with high vaccination rates, if at the same time it is recognized that the symptoms, I assume of Omicron, and the new cases are generally mild or non-existent, excluding for particular risk groups? Dr. Etienne.
Thank you for that question. We continue to recommend key public health measures for all countries because they are still important. These measures include, as we said before, the use of well-fitting masks, physical distancing, ventilation of indoor spaces, the avoidance of crowded spaces, especially during parties or celebrations, and hand hygiene. That even in countries with high vaccination rates, taking these precautions will help reduce the transmission of the SARS-CoV-2 virus, including all of its variants. We are still in the midst of the pandemic. I just said we had 15,000 deaths related to COVID-19 in the last week alone. More than 2.4 million people in the Americas have already died since the pandemic began. And so we cannot let our guard down. The Delta variant continues to cause new COVID cases in the Americas, and the Omicron variant is on track to become the dominant strain. As you know, it spreads more quickly than other detected variants, particularly in enclosed spaces. While Omicron is circulating widely, it is causing hospitalizations and deaths, and even the less severe cases are flooding health facilities. The new wave of infection is by no means mild for our health systems. The Omicron variant is already challenging our health workforce and limiting care for other diseases. People who have not been fully vaccinated remain at high risk for severe illness and death. So for now, we must still be careful and we must still continue to maintain these public health measures. Thank you.
Thank you very much, Dr. Etienne. Pasamos a las otras preguntas. Recibimos muchas sobre las pruebas.
We now go on to our other questions. Adrián Aguirre, who is from summedico.com, wants to know the situation or the status of tests. Is there a worldwide scarcity? Another question is, what is the position of PAHO regarding home tests or the recommendation to countries who are overwhelmed by people who need to know whether they are positive or not? And also in English, a question from the Tribune in the Bahamas.
Testing pilot in the capital. How helpful will this be in managing the pandemic? Entonces paso al doctor Aldigueri, quizás puede comentar sobre estos temas.
Dr. Aldigueri, could you please comment on these questions? Thank you very much. We have 3 questions, and so I'll try to answer them independently from one another. So for the first part of the question, from the beginning of the pandemic, we have developed a large amount of diagnostic options that we can break into 2 large groups. The molecular tests based on the PCR principle, which can be implemented using manual or automatic methods, and the rapid test based on antigen detection or detecting viral proteins. While during the most intense moments of the pandemic back in 2020, there was a large scarcity of material globally, especially for molecular testing. At this point in time, production of inputs has been increased, and we have different vendors and different supplies to maintain surveillance regionally. Validated tests, as was emphasized during Dr. Etienne's remarks, can be obtained through the PAHO's strategic fund. However, this situation can change depending on the epidemiological context and the indiscriminate use of testing. This is why we make an appeal for the rational use of resources based on clear strategies of surveillance and testing, and prioritizing suspect cases. In other words, individuals who are symptomatic and who are found in different healthcare levels. Regarding the second question from Panama, at this point in time, we do not have enough evidence to back the use of home testing. We need to be very careful with the indiscriminate use of these home tests, especially because of the likelihood of taking the sample incorrectly and obtaining false negatives. And this can generate a false sense of security, thus leading to relaxed protection measures and therefore a potential increase in infections.
The Bahamas with a free COVID testing pilot program in the capital city. PAHO commends the establishment of free COVID-19 testing programs in countries, including in the Bahamas. These initiatives are very helpful for increasing access to testing. Always, as highlighted by Dr. Etienne and during my previous comments, always when tests are rationally used in symptomatic patients. I hope I have answered the concerns of the journalist. Thank you.
Gracias, Dr. Aldigueri. Pasamos
Thank you, Dr. Aldigueri. Now we go to a question from Panama. Enrique Cárdenas from La Prensa. How do you assess the situation in Panama, which is recording a high number of transmission, what is the main recommendation to Panamanian health authorities, Dr. Ugarte? Thank you very much for your question. Thank you, Luciana and Henry. It is considered that Panama is on its fourth wave with high incidence of cases. For example, in the last 24 hours, the highest figure of new cases has been reported from the beginning of the pandemic, 11,519 positive cases and over 34,000 new tests carried out. This context requires that measures be kept to reduce contagion, especially when we realize that the Omicron variant is causing very active transmission in many of our countries. The best measures are physical distancing, proper use of well-fitting masks at any time when we are in public, and hand hygiene, hand washing. It is also important to continue to promote and facilitate vaccination of the population. The vaccine is the most effective protection measure vis-a-vis serious cases and death. And even though it does not reduce transmission, it reduces the possibility of saturating and overwhelming health facilities, and it reduces the number of deaths, as we've seen in many countries. Panama has a high vaccination coverage. They have reported about 82% of full vaccination scheme in people over 12 years of age. And so we urge that those who have not yet been vaccinated to go ahead and get vaccinated. Panama has enough vaccines. So these measures, or the vaccination plus the other public health measures, should be kept. I think the authorities are adopting the appropriate measures, and the population need to continue to comply with these measures to protect themselves and their families. Thank you. Thank you, Dr. Ugarte. Now we have a question from Mexico, Joaquin Tinoco from Agencia Mexicana de Noticias. What is the percentage of vaccination in the American continent? Is it more important to give booster or to take vaccines to the most marginalized areas of the continent? Dr. Barbosa. Thank you very much. Thank you for your question. As our director mentioned in her remarks, vaccination has progressed a great deal in the region of the Americas. Today, we have already 4 countries who have vaccinated over 75% of their population with the full vaccination scheme, Chile, Cuba, Panama, and Uruguay. So we have, in general, over 60% of the population vaccinated, but we have still 10 countries which have not yet achieved the 40%, which was the goal for the last year of December 2021. Fortunately, we only have one country, Haiti, which has not achieved 20%, which is the minimum we considered. 20% corresponds to the most vulnerable population. So that's the first goal in vaccination, which is to save lives. So significant progress has been achieved in the Americas with the efforts by the countries, bilateral agreements, thanks to donations from important partners such as Canada, United States, Spain, and others. The COVAX mechanism has progressed quickly with the vaccination, and the great challenge today is to achieve equity in vaccine access. It's important that all countries can have access to vaccinate equitably. Regarding the question, the most important thing is that each country has access to vaccinate at least 70% of their population. We know that access varies in each country, but when we support countries to develop vaccination plans, it's because vaccines need to be used according to priorities. First, maintain services working, maintaining healthcare workers healthy, and then protecting the most vulnerable members of the population to prevent them from having serious forms of COVID, senior citizens, those who have other comorbidities, and then we should go and reach the whole of the population. So it's important to guarantee that all countries may have access to vaccines, because the emergence of Omicron has been an important scenario. If we leave the virus to circulate freely in a country that does not have significant access to vaccines, we'll always have the possibility of other uh, uh, um, problems, and that's why equitable access is important, and access is important in general. Thank you, Dr. Barbosa. From Mariana Suque, Efecto Cocuyo, regarding re-implementation of quarantine, given the advance of Omicron variant in Venezuela, they have spoken about the possibility of returning to the 7 flexible days and 7 quarantine days. What do you think about this? Dr. Ugarte, over to you. Thank you, Mariana, for your question. In general, in all countries, it is necessary to adapt implementation of quarantine, isolation, and other measures analyzing levels of transmission of the virus, and also levels of hospitalization, general hospitalization, and ICU. In Venezuela, we understand that even though cases have increased significantly, hospitals have reported manageable levels of hospitalization and ICU beds as well. However, the situation could change rapidly, quickly, given the Omicron variant and its transmission. And if the levels continue to be at the rates reported in past weeks, it may be the demands on the health services will increase. And therefore, the measures that are being implemented should be adapted to those two aspects. On the one hand, transmission of the disease and occupation of hospital beds. These measures should be adopted as a function of the situation in the different countries, and also at local subnational levels. But many times national measures can help to reduce transmission throughout the country. So in the case of Venezuela, it is necessary to continue to assess the measures and to follow recommendations from national authorities as well as state level authorities in order to continue to manage the pandemic sensibly. Thank you. Thank you, Dr. Ugarte. From Elena Ochoa from Uno TV, Mexico City, she asks, she has 2 questions. First, there are several experts from Mexico who consider that the pandemic may end in 2022, and then coronavirus will become endemic as it happens with other viruses such as influenza. Does PAHO think this is a possibility? Also, other infectologists from Mexico consider that the drop of contagion of Omicron variant in Mexico could start in the capital city by March, so that the drop in transmission will start in March. What do you think of this? Over to you, Dr. Aldeguieri. Yes, thank you. The main characteristic of this pandemic continues to be the uncertainty regarding its evolution, and this should urge us to be cautious. While it is possible that eventually SARS-CoV-2 virus will become quote unquote endemic, we think that this will take several years to occur. Meantime, we will have new outbreaks, even in places where they have had high vaccination coverage. And in fact, this is what's happening with Omicron in the Americas. We've seen significant surges in all the subregions of the Americas, despite the fact that vaccination rates are higher than 70% in some countries. It is too early yet to predict when cases will begin to drop due to Omicron variant, including Mexico. The dynamics of Omicron in the next few weeks and months at regional level and sub-regional level in the countries will depend on the implementation, the strict implementation, sustained implementation of public health measures and the use of masks. regarding the impact on the mortality due to Omicron, it will depend largely on vaccination coverage in people at risk and the capacity of health services to maintain service, even though there is a sustained flow of people with complications. We should also emphasize that the Omicron variant is well adapted to the human host, and it has a capacity to infect, which is 3 times higher as compared to the Delta variant, which up until recently, a few months ago, was considered the most infectious one. Additionally, the amount of mutations accumulated in the Omicron genome facilitates its avoidance, a partial avoidance of the immune response generated by infection, prior infection, and vaccination. However, we have increasingly sound evidence showing that people who have had the full vaccination scheme have a dramatic decrease in severity of infection and risk of hospitalization, leading to disease with low symptoms. However, and this is important to emphasize this over and over again, in people who are not vaccinated and who have another risk condition, the disease can still be serious and even lead to death. I hope I have answered your all the facets of your question from UNO TV. Thank you.
Thank you very much, Dr. Aldiguieri. Now we have received some follow-up questions on the tests from Venezuela. And we have Gabby from Contrapunta and Kevin, who is asking how many diagnostic tests are conducted in Venezuela on a daily, weekly basis, and whether they are sufficient, and whether PAHO has offered tests to the government to be able to freely give them to the population, and how many tests can PAHO provide Venezuela? Dr. Ugarte, do you have that information, that specific information? Could you please address that? Thank you, Luciana. And I would like to also thank Vanessa for her questions. Venezuela implemented molecular testing recommended by PAHO from the beginning of the pandemic, and the Ministry of Health has strengthened the laboratory network by decentralizing testing in several districts, such as in Yaracu, starting in 2020. Venezuela has the capability for over 5,000 weekly tests, and also to maintain surveillance of COVID based on the protocols, including the use of rapid testing with the use of antigen testing to increase diagnostic capability and identification of cases. More than 460,000 antigen tests and more than 375,000 test kits have been donated by PAHO. Starting in February 2020, PAHO has been supporting the countries in the region by providing reagents and also critical material, and facilitating the material needed for testing by using COVAX, and also for the strategic purchasing of key health supplies. The support that PAHO is providing Venezuela and the other countries in the region is key and continues, and the number of tests that have been allocated to Venezuela may change based on the administration of the test, and also the change of the epidemiological conditions, and also the demand for tests and the demand of the health services in each country. So we are closely monitoring the situation from our own representation in Caracas and through our partners to be able to verify the additional needs of Venezuela and other countries to continue with that cooperation. Thank you very much. Thank you, Dr. Ugarte. The next question in English.
In Trinidad Tobago asks, in Trinidad and Tobago, COVID cases, case numbers and deaths have been rising. The government recently announced a vaccine policy for public sector employees, requiring them to get vaccinated or be placed on no-pay leave. What does PAHO think of this policy? Dr. Barbosa?
Thank you for this question. Trinidad and Tobago has made a tremendous effort to increase the vaccination coverage. They have already vaccinated around 50% of their population. And we understand that every government wants to take the measures that are aligned with their laws and regulation in order to increase the vaccination coverage. Of course, that is very important to discuss what are the more effective measures that we can implement. Unfortunately, in the Caribbean countries, we have had some vaccine hesitancy. People that are listening or getting information, fake news, rumors about vaccines. This was very well detected in some surveys in the Caribbean. And in these surveys also, we can also see that the doctors and nurses are the most important source of information for the families. So I do believe that it's very important that Trinidad and Tobago and other countries in the Caribbean receiving the technical support from PAHO needed to develop and implement a very comprehensive communication strategy. They needed to reach out to the physicians and nurses. They needed to provide all the information that they need to share this information with families and communities. So I think that it is important to use all the measures that are allowed by the national laws, but also to see that the most effective measure to increase the vaccination coverage is to provide clear and transparent information and to get the physicians, nurses, religious leaders, community leaders engaged in the same purpose to get people vaccinated to save lives and to control the transmission. Thank you.
Thank you, Dr. Barbosa.
Thank you, Dr. Barbosa. The next question is by Medscape from Argentina. Matias Levy is asking the following, and it is a long question. An aspect that has not been addressed has to do with those patients that get COVID within the hospital setting when they were hospitalized for other causes. Is there any estimates in the region of the scope of this problem? Is it mandatory for the hospitals or countries to report these cases? Could the risk increase now that countries have shortened or eliminated quarantines for or isolation for health staff, or even they're assessing if doctors, infected doctors, can go to work if they are in good health in general? Dr. Aldiguieri, could you please answer, or do I need to repeat the question? It is a long question. No, our colleague has shared this in the chat, and I see the question, and I will try to tackle this from two different and divide this in two blocks. So some studies have seen that the hospitalized patients report being positive to COVID. In our region, the positive reports vary depending on the countries for hospitalized patients, so it is difficult to have a regional idea. Patients are hospitalized for other reasons and not as a consequence of complications due to COVID. This is a situation that has been frequently seen as of December 2021 with the Omicron strain. So this could be very related to different factors. First, given the high rate of asymptomatic patients in the community, those patients were detected during initial checkup for their hospitalization. That is to say, the initial checkup, the COVID-19 test is a standard test in many countries prior to hospitalization of a patient. And the second factor is that those patients became infected in the health services by being in contact with other positive patients who were symptomatic or asymptomatic. It is important to bear in mind that hospitalized patients may have comorbidities and diseases that make them vulnerable or susceptible to complications due to COVID, and they need to be monitored closely, in particular if they have not been vaccinated, if they are older, and if they have immunosuppression or some other sort of comorbidities. As to the second part of the question in connection with the health authorities in some regions, in some countries of the region, for positive health workers to continue to work. We have also seen that in other areas of the world at the beginning of the pandemic, and I am thinking of Italy, for example. This type of decision was made based on a risk assessment and also based on the following criteria: to allow for positive health workers who were asymptomatic or that had very mild disease to continue to care for patients of COVID-19 that were confirmed in the services dedicated to that disease. And this was within a context of strict compliance with personal measures for those staff workers, including adapted isolation for those health workers to minimize their contact with individuals beyond the work environment through different measures, and such as, for example, staying in an area that has been devoted to the health establishment that is providing the services, and also to have infrastructure devoted, such as shelters or specialized hotels for this purpose. If they need to stay at home, there should be isolation in a dedicated area to avoid contact with family members, and also they need to travel to the hospital and back to the place of accommodation in their own vehicle. So I hope that my answers have covered both aspects of the questions by our colleague from Medscape. Thank you. Thank you, Dr. Aldiguieri. We now move on to questions from Nicaragua. Gabriela Solorzano from Channel 12 is asking the following: Nicaragua is not reporting many increases as compared to the other countries in the region. Do you expect Nicaragua to have a new wave after the Christmas and holidays? And also, do you have any reports of new variants circulating in Nicaragua? Thank you, Luciana. Thank you, Gabriela, for this question. We have seen a significant increase of new COVID cases in all of the countries in Central America, and we're estimating that this situation will also be the situation in Nicaragua. To that end, it is very important for everyone to reduce transmission in public places by wearing masks, and as soon as we have symptoms that are related to COVID, to wear the mask at home, and also to be able to use areas that are closed at home only to us, and also to alert those individuals that have been in contact with us 48 hours prior to the onset of the symptoms that we do have symptoms, and for those individuals to also monitor their symptoms and their personal situation. It is key for the public health measures that have been implemented to reduce transmission in the area to continue to be implemented in Nicaragua, to continue to have a manageable number of cases, and that includes avoiding crowded places, to maintain as far as possible physical distancing, wearing masks in closed spaces at all times, and also to maintain physical distancing and continue with hand washing. Nicaragua has received the necessary material from PAHO for the genomic sequencing of the virus, and we trust that soon Nicaragua will be presenting a report on the circulating variant in the country. So we encourage all of PAHO member countries to share the genomic information. This is one of the most important elements to be able to follow the course of the pandemic, but also to control it as fast as possible. And this is also related to the information that is channeled through the international health regulations, but also the information shared with the population so that the population can implement the right measures based on the transmission level. Thank you, Dr. Ugarte. We also have a follow-up question by Gabriela on the vaccines. Do you expect to send more vaccines to Nicaragua, and when would that take place? Dr. Barbosa, do you have any update on that? Yes, thank you very much for Nicaragua's question. Nicaragua has made great progress with vaccination. Nicaragua has also received through COVAX 4,200,000 doses of the vaccine. Nicaragua is one of the 10 countries that is being supported by the facility in the region, so they have received the vaccines without the need to pay for them, and Nicaragua will continue to receive vaccines through COVAX until at least they reach 70% of their population. For the next couple of days, Nicaragua will be receiving about 490,000 doses of the Janssen vaccine. This is a vaccine that can be used in only one dose, and this vaccine will be delivered through COVAX, and this is the result of a donation from Spain. As soon as we have the flight number and the date, we will be communicating with the authorities, the national authorities, for them to receive them immediately and to also to authorize the entry as we have done it so far. And Nicaragua and the other 9 countries that are being supported by the facility will continue to receive the vaccines until they reach a vaccination coverage of 70%. Thank you very much. Thank you, Dr. Barbosa. We now move on to a question from Chile. Eduardo Wu from Tele13 is asking, in our country, we started to apply the 4th dose or a second booster. Along this line, what are the comments you may have, since WHO has questioned its application due to the lack of vaccines in other regions? What could we tell the government and also to the population when listening to messages that do not agree with each other when they are asked to be vaccinated, and on the other hand, WHO is questioning their use? Decisions on the strategy to be implemented by a country is a decision to be made by the national authorities, and a decision that takes into account vaccine availability. Chile is a country that has a very privileged situation in the region because thanks to the effort of their government and also bilateral and multilateral agreements, and also they working with the COVAX facility, they are one of the countries with the highest access to vaccines. So it is a situation that unfortunately other countries do not have in the world. And also we need to have, they also have strong basis for their decisions so that a rational use of the vaccines can be made, avoiding vaccination of the same individuals while other individuals have not received the vaccines. Third, I think that it is also very important to mention that in each country, the priority we think is to complete the vaccination schedule. Look at the gap that we have in several countries among the individuals that were vaccinated first, but that did not receive the second dose, or individuals that were recommended to take a booster, such as the elderly and individuals with immunosuppression, but they have not even been administered the third dose. There is a lot of fake news about individuals who had COVID and who do not need to have the 3 doses. That is not true. So I think that it is even more important now, instead of a general recommendation regarding a 4th dose, where we need more information, at least from other areas of the world, it is very important to carefully review and also to be able to overcome these gaps. I think that in public health, we need to be very careful because the measures need to be the most effective possible. And at this point in time, to close the gaps, bridge the gaps, and also for everyone to have a full vaccination schedule is the most important aspect. Finally, it is always a good idea to underscore that vaccines behave differently. So Chile has been using some vaccines that were not used in Europe, and the US used different vaccines. So it is always important for the country to always have their own information, studies that prove the need to have additional doses at this point in time, and also with the information and the evidence that we currently have, there is no general recommendation for a fourth dose. There are specific recommendations for some specific vaccines that do need a third dose for the elderly and for immunosuppressed individuals. Thank you very much. Thank you, Dr. Barbosa. We continue with vaccines. This is a question by Agustin Caroso from Full Noticias in Argentina. Agustin is asking, many Argentinians are vaccinated with Sputnik, and it has not been approved by WHO. What do you think about that, Dr. Barbosa? Could you please refer to this? Yes, thank you. Thank you very much for this question. Agustin, the authorization process for a vaccine takes place in each country by the national regulatory authority. In the case of Argentina, this is ANMAT, that is one of the reference authorities that we have in the Americas. Vaccine producers who would like to have their vaccine or emergency use by WHO, for example, to be able to sell those vaccines for the COVAX facility or the revolving fund, submit their data for WHO to review the data. The Sputnik vaccine is still undergoing the process, as well as many other vaccines that have started the process but have not concluded this process. Our expectation is for all of the vaccines to submit the necessary data to WHO, and that more and more vaccines are authorized for emergency use by WHO, so that the COVAX facility, the revolving fund that PAHO has, can have greater availability of vaccines to offer. So the process, the Sputnik's process, continues in Geneva. Oftentimes, more and more information is needed, and this is part of a dialogue between the Geneva team and the producers, but we still do not have a date as to when this process will be concluded. Thank you. Thank you, Dr. Barbosa. We're now reaching the end of the session, and we move on to the last question from Haiti.
Desejour from the Haitian Network of Health Journalists asks, after 2 years of fighting COVID, are you more optimistic about the real results for this year? Dr. Etienne, that's a good concluding question for you.
Merci à Roselyne. So as we enter the third year of this unprecedented global pandemic, we must continue to be careful and to build on our work with the countries. We made progress to reduce mortality from COVID-19 in the last 2 years by helping the countries develop their health surge capacities to be able to treat patients. And I believe that our efforts to roll out vaccine campaigns were crucial. We have reached some 60% of the population. As I said before, our goal is to vaccinate at least 70% of the eligible population in every country this year with rational immunization protocols that may include additional doses or boosters as necessary to protect people at high risk, and importantly, to protect our health workers. Health systems are now better prepared for surges in patients, and vaccines continue to reduce severe disease and death. Our primary healthcare systems also need to prepare to handle and fairly distribute new therapeutics or treatments. WHO has recommended 2 new COVID-19 treatments that add to our tools. One of those is a drug for rheumatoid arthritis that was previously used for that. Another is a monoclonal antibody. But we have to admit that access is limited, and in part due to high prices and low supplies. But COVID-19 remains a serious threat. The rapidly evolving situation means that we must preserve for now the discipline of the important public health and social measures which have helped limit transmission. But let's have hope. Be assured that this pandemic will come to an end sometime. How soon and in what mode will depend in large part on each of us doing our part to limit transmission. So yes, I am hopeful. Thank you.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.